How, to start off, we'll start off with you, Carolina. To start, can you describe the model that you've been practicing for more than 35 years? You clearly know, both of you know your models in and out. So please go ahead and just describe to our attendees what kind of model you have.
Well, it's basically high fee, low volume that I've always aimed at developing. It was my dream from university. It could it could be related to the education I had also, coming from a kind of, maybe the word might sound a bit rigid, but elitist family. I considered I had to serve that type of layer in society, that 1%. So that was basically my model.
Okay, perfect. And so where do you find patients for the model that you had?
Well, as egocentric as it may sound, I focused on me. I was in a city that was a capital. It was Madrid. There are a lot of dentists out there. When I got there, I had very little experience, and competition could have been and was criminal. So I said to myself, what can I offer that others can't, aside from dentistry, because we're all dentists? So what can I offer? What was my unique value proposition? And that's what I tried to define, my unique value proposition. I was not experienced. I had worked for someone in a dental office for 4 years. What did I have that others might not have? And I went into languages. I spoke 3 languages fluently, communities, international schools, foreign corporations, and I tried to really look for niches within the specifications that I had as a practitioner. I did some very personalized direct B2C and B2B marketing, using the phone book at that point, and gluing stamps on envelopes. And if I was lucky, they had an adhesive strip. Otherwise, I would have to close the envelopes, with my tongue. But it is, I mean, that's where it was, 1991. So my advice today would be, if you aim at being a solo practitioner or in a small select group practice, find a niche that you can relate to. If you're trying to compete with other dentists based on price, it's going to be absolutely ridiculous. You have to find what is your unique value proposition. Patients trust the dentist. So you have to be the one putting yourself out there, not dentistry, because a patient doesn't know if you're good or bad. Find the uniqueness in you, and that's a Bali sentence.
Thank you for that. So you didn't.
I'm sorry, I would also add to that I had to define what patients I wanted. Who did I want as a patient? What profile did I want? Define the persona. And based on that persona, adapt my offer. And that's super important. So my value proposition and what was the persona that I was looking for. Sorry.
Thank you for that. So you did mention, trust. You're obviously talking about niche communities where, you're maybe targeting the 1%, the 2%ers. How do you go ahead and make them trust you so that, they keep coming to you?
It's about the journey. It's not about dentistry. Once again, a patient doesn't know if you're good or bad. The only thing that I focused on when I started in dentistry was don't hurt them. Don't hurt them. Make sure you're soft. Make sure you have feather-like hands. I focused on that because I knew they could not tell if I was good or bad. They could not tell how long my crowns were going to last or my fillings were going to last. So I had to focus on all the rest. And that was about the journey. And being soft with patients physically, with your hands, is part of the journey. The environment, the office, everything. And when everything is perfect, they cannot imagine for a second that you're not a good dentist.
And one last question here. Again, you're not going to the masses. You're going for that 1-2% at the top. There aren't that many people up there. So how long does it take you to build a patient base that you can live on for 35 years that you practiced?
Well, I mean, if we're talking about the beginning, I started off with very low fee because I was new. Nobody knew me. I was in Madrid. I had just arrived from France. So of course, I started with a very low fee, but always excellent quality. I was giving excellent quality. I was going to all the shops in my neighborhood. I was sending mails, and they say that you need 1,500 patients in your database to live off them. Just if the referral process works as it should, statistically speaking, it didn't take me long. I mean, I'm not saying to reach those 1,500 patients, but within 1 month, I was covering the expenses of my office. So you have to go out there. Things haven't changed. 1991 or 2021, you create a startup today, you have to go out there. You have to validate your product and you have to go and get your customers. This is the same, unless you want to be insurance dependent and union dependent, in which case they will come to you. But then the persona is totally different and the journey is not comparable.
Thank you for your answer, Carolina. Definitely, you know, one business model and one practice model that we have with us here today is kind of that more luxury one, which is the one that you described. We're going to go ahead and take the same question here to Rick. So, you know, can you go ahead and describe your model?
Well, I've had an entirely different journey. I was never a solo practitioner. When I came out of school, I went to work with a very fine businessman dentist, learned a tremendous amount about the management of a practice and how to grow it, who had large relationships into, as Carolina said, labor unions and relationships, and brought mass people into that practice. Ultimately, I ended up moving in a little bit different direction, where I went to have one of the multiple practices we own to be imparted with, you know, my personality. So I've always practiced with other professionals. I always had the one team, one goal approach, but being with other professionals always allowed me to learn from others, not just their own personal experiences. Also, everyone has their own personal strengths and weaknesses, likes and dislikes. Therefore, a team works better for my personality. So I've always worked within a team. So my practice currently, and it's got 2 stages to it, because initially my practice was focused around my implant training, advanced reconstruction, even though we were working on insurance patients. So I was always doing the best dentistry we can, you know, provide. And when I had the opportunity to find that one day I turned, I couldn't move my right hand, I had to then evolve into something else. So what I ended up with is operating a multi-specialty GP practice, all right, totally unaffiliated with any DSO organization. We have a collective of doctors, hygienists, clinical staff, managers, administrative staff. They're all guarded by a brand motto. So I put different business practices and knowledge into work to be able to try to create this brand. We're one team, one goal. And internally, it's to achieve predictable results. Externally, it's ultimate dental care, because we are providing care for our level, all right? We are providing all the options, whether it's advanced implant dentistry, sinus grafts, advanced reconstruction. We're doing all those things in the office, just slightly modified. So one team, one goal to achieve predictable results. We have to meet or exceed patient expectations every single time. All right, to accomplish the goals, we partner with our patients when determining treatment options, path to get there. We set achievable goals. All right, communication is a critical part of our puzzle. All right, we work in a larger office, so we require more of everything: supplies, equipment, staff, and obviously patients. It gets way more complicated with more people and more personalities. Our participation with insurance and PPOs is a necessary part to ensure that we have a steady flow of available patients for the staff. We work in a collaborative environment. So our GPs are talking face-to-face with the specialists in the office, all right? And that's done so they can orchestrate the visit and the experience that the patients expect and desire, all right? All of this offers a patient convenience and basically more affordable care, because we're space sharing at a certain level. As an own and non-practitioner, my role is business support, which is different than what it was before as being a surgeon. So for business support for the clinical team, I don't treat patients. I provide an environment for the team to focus on what matters, and that's really the patients. That's our secret sauce.
Thank you. So definitely a very different model to the one Carolina described, but how did you go about, getting that volume? Clearly, you're not touching the 1-2%ers, you're going more for the masses. So how did you get that volume?
We're going for the marketplace we're in. We started out, like I said, my original senior partner had relationships. We had multiple offices, and that was what really gave me my start. What would change is that we look at every individual patient as a referral source, no different than a boutique practice. But we also look at it to say a patient that's not treated properly is not complaining to 1 or 2 or 10 people. They have the voice that's being heard by 50, 100, sometimes 1,000 people. So everything is patient-centered in the office. So we're able to really work at developing relationships having to do with large corporations, other labor unions, and any other affiliated groups. But we still build our practice a good old-fashioned way, one patient at a time, one patient time, next one time, next one time, next one. There's really no magic to building these larger practices. Everyone's got to be on the same page. That's the key.
And then one last question for you here, Rick. How do you deal with the volume, right? You need facilities, you need the staff, how just walk through us or walk us through that a little bit.
Well, number one, you need great people. Everything starts with people, and you have to motivate them. You have to treat and compensate people properly. So that's your staff. You need a larger facility, absolutely. So there's a different set of economic principles you have to follow. So you have to really look at dental care at that level as the business of dentistry. That's the difference that a lot of solo practitioners or smaller practitioners don't really have all those systems in place. So the only way it works is by organization, SOPs, and everybody have a unified front.